Thank you to everyone who is attending this presentation. I've been researching the 1918 influenza epidemic for 2.5 years now, and I continue to learn more about this topic with each presentation. I hope you walk away from this presentation learning something you didn't previously know about North Carolina's response to the epidemic. Before I dive into the history, I wanted to acknowledge the archives and resources that I consulted for this presentation. I reviewed books, journals, and archival collections at ECU's Laupus Library, where I work, artifacts at the Country Doctor Museum, and archival materials and microfilmed newspapers at ECU's Joyner Library. The online repository, Digital North Carolina, also allowed me to view digitized versions of local newspapers. I'd now like to provide a quick outline for this presentation so you know what to expect in the next 30 to 40 minutes. I'll begin with an overview of the influenza virus. We'll look at the big picture, the context for when the flu epidemic began. We'll speculate a bit about where the virus started. We'll then provide a general timeline of events and talk about when the flu arrived in North Carolina and how it spread. The second portion of the presentation will focus on the experience in Eastern North Carolina. We'll talk about the doctor shortage due to the timing of the epidemic, the role of the Red Cross in public activism, the role of newspapers in spreading information, treatment and prevention for influenza, and case studies looking at specific cities and how they responded to the flu. The final portion of the presentation will look at the aftermath of the epidemic, talk about the death toll, the Rural Health Act, public health movement, and I'll provide a brief closing statement. During the COVID-19 pandemic, I've been thinking about the many parallels between what's happening now and what happened during the 1918 flu pandemic. There are so many of these parallels, but also several differences. I'll touch on some of this during the presentation and in my conclusion. In January 1918, World War I entered its final year, but with the impending end of the war came a deadly virus that consumed the world. The disease, known as influenza, the Spanish flu, the Blue Death, and the grip, infected soldiers in the trenches, civilians near the war in Europe, and civilians at home on home fronts far from the conflict. In North Carolina, every community experienced the onslaught of the disease. By the time the epidemic concluded in March 1919, more people died worldwide from influenza than were killed in the Great War. The disease claimed the lives of at least 50 million people across the world, 675,000 Americans, and over 13,000 North Carolinians. An estimated 1 million of 2.5 million North Carolina residents caught the flu. At its height in the fall and winter of 1918 through 1919, the influenza virus infected 20% of the North Carolina population. We don't know for sure where the mutation of the deadly virus occurred. At the time, many called it Spanish influenza because the Spanish press publicized the death toll more than other countries, whose newspapers were censored to prioritize news about World War I. Since then, however, many believe it may have origins in Asia or even Kansas. Haskell County, Kansas has emerged as a likely culprit because that community experienced a severe outbreak in January 1918. Many men who were exposed to the disease went to an army camp in central Kansas, infected other army recruits, and took it with them to Europe. Scientists today know that the 1918 strain of influenza was one of the most lethal versions of the virus. This virus strain was likely a mutation of the bird influenza virus and the human influenza virus combined in pigs and spread to the human population. Scientists didn't discover the 1918 virus until 2005, despite identifying influenza A and influenza B by the 1940s. The lethal strain of influenza that swept through North Carolina in October 1918 had severe symptoms. The disease began with typical symptoms of the flu, including body aches, coughing, chills, and fever. However, what made this flu different was the rapid development of pneumonia along with or soon after the flu symptoms, often causing victims to turn blue from lack of oxygen. Influenza-induced pneumonia was the chief cause of death during the epidemic. Dr. Robert Fales of Wilmington, North Carolina, described his experience with influenza as such. The chief symptoms, which I can personally verify, were a rapid progressive feeling of weakness, aching, cough, chills, and fever. Within an hour or so, it was for one to become bedridden and nursed by terrified members of one's family. In many cases, every member of a family could develop the disease eventually, whereas in other families, one or two members seemed immune to the virulent flu. There were 3 waves of influenza that occurred between early 1918 and April 1919. The first wave was in the spring of 1918. This wave had a fairly low death rate. It was such a mild form of the flu that it was easily missed or misdiagnosed. The second wave of the flu occurred in the fall of 1918. This had the highest death rate and infection rate. Healthy young adults had the highest death rate during all 3 waves, but it was particularly high during the second. The third wave occurred in the winter 1918 through the early spring 1919. There were many reported cases, but fewer deaths than during the second wave. The case studies discussed later in the presentation will focus on the second wave in North Carolina. Influenza arrived in Wilmington in September 1918, with the first case reported on September 19th. Since Wilmington is a coastal town, the disease spread quickly as people traveled through the ports, similar to how today's pandemic had hotspots near airports. Quarantine was instituted, which helped keep the flu at bay in Wilmington, but nevertheless, the virus spread. By late September, the disease reached Charlotte, traveling by the rail lines. 5 days later, the number of cases in Charlotte increased from 3 to 140. Camp Green, the military training facility near Charlotte, quarantined the base, but the flu still spread. By early October, most communities in the state began seeing cases of influenza. That October, the University of North Carolina had more than 500 people infected with the flu, including President Eder Kidder Graham. Like so many others, President Graham developed pneumonia and died on October 26th. A few months later, acting university president M.H. Stacy also died from influenza. Eastern North Carolina communities suffered from influenza alongside the other communities across the state. The ongoing war in Europe and the United States entrance into the war in 1917 resulted in a shortage of doctors left on the home front. Some doctors volunteered while others were drafted. Dr. Cecil Garrington of Bethel, North Carolina, served in the American Expeditionary Forces. As the only doctor in town, his presence was missed during the epidemic. On April 7th, 1919, at the very end of the epidemic, the citizens of Bethel, North Carolina, wrote the letter pictured on the screen. In it, they requested that Dr. Garrington return home from active service. Although the letter does not specifically mention the influenza epidemic, the citizens wrote, "You have been away from home now for nearly 2 years, and we have been forced to undergo many difficulties and anxieties during your absence. Please, if possible, plead with your commanding officer to recommend your release. We need you here and want you to come home." Other communities struggled as well with a shortage of doctors, but the Red Cross and community members stepped in to help where they could. Red Cross chapters provided localized relief to communities during the epidemic. When needed, the Red Cross National Committee also sent additional nursing personnel. One such nurse, known simply as MKB, was assigned to Morehead City, North Carolina. In an article recalling her time there, MKB described the responsibility of the Red Cross nurses who the committee sent. These nurses typically formed a committee chapter on influenza to work with the local public health officials. Together, they organized volunteers to provide care for the flu-stricken, opened soup kitchens, and established temporary hospitals. In an issue of the American Journal of Nursing published in May 1919, MKB described her experiences organizing the people in Morehead City. A mass meeting was held in the Red Cross rooms where we organized for work. The town was divided into districts, each district having a committee to make house calls. I was on duty nearly 20 hours a day, the first 3 days and after my arrival, and from 14 to 18 thereafter, only going off duty when I could no longer stand. From the beginning, the physicians, the volunteer nurses, and I wore face masks made and furnished free by the Red Cross. In addition to the services provided by the Red Cross, community members helped each other throughout the epidemic. Individuals offered aid to community soup kitchens, while other volunteers organized to care for the sick. The relief work of these individuals was particularly important in rural areas where country doctors were overwhelmed and often ill themselves. This type of public activism was a national phenomenon and demonstrates the goodwill of Americans and North Carolinians alike during this bleak period. The newspaper article on the screen is an advertisement from the October 11th Roanoke Beacon stating that the Plymouth, North Carolina soup kitchen was open. One woman named Mammy from Plymouth described her work in the soup kitchen in a letter to a relative. I have been delivering soups for the last 2 weeks to the sick, those that have no one to wait on them. We have a soup kitchen downtown. We make beef and chicken soup, boiled custard, chicken salad, lemon cream, and sandwiches. In some homes, every member of the family would be down with it. In others, 2, 3, and 4 would be sick. We carry things all around town and as far as 10 miles out in the country. According to the Wilson Daily Times newspaper, the Wilson Health Department organized relief efforts for the whole county. In early October, Dr. Smith, the local health officer, announced a volunteer organization for nursing the sick. There were a number of people in the county who could not provide themselves with the necessary nursing, and so a volunteer group was needed. The health department requested donations of blankets, pillowcases, and nightgowns to be delivered to the sick. They also asked individuals who owned automobiles to volunteer as drivers for those delivering aid and food, since so many of the people in need lived miles from Wilson. A local women's club also provided aid for the sick. The group collected food, prepared soup, and delivered it to those in need. Newspapers served as a powerful force to spread the word about symptoms and quarantines alike. Most newspapers also frequently published front page articles reporting how many flu cases and deaths a town suffered. Local health departments used the press to inform the community of school, church, factory, and warehouse closures throughout the epidemic. These articles are vital to understanding the day-to-day changes in Eastern North Carolina towns during this time. Local newspapers also provided information about influenza symptoms and relief. On October 3rd, 1918, the State Board of Health composed a statement which the state government released to the press. Local newspapers published the statement warning North Carolinians not to share eating and drinking utensils and to always cover their mouths when sneezing or coughing. The board statement also recommended restricting public events to avoid spreading the disease further. The newspaper on the left has an article from the State Board of Health highlighted, while the newspaper on the right highlights the notice that the Greenville tobacco market is temporarily closing. As the epidemic worsened by the day, the Board of Health banned most social interaction. Tobacco markets closed, factories shut down, public schools are out of session, and churches didn't offer services. Funerals occurred at the cemetery, not inside churches, for fear of spreading the flu further. During the quarantine, local medical professionals insisted that people clean and circulate air in their homes. Keeping windows open to ventilate the home and dilute germs in the air had been seen as a popular protection against disease for decades and was applied once again when influenza swept through the state. In a letter to her son, Maria Whitehurst of New Bern described her thoughts about fresh air and quarantines. I believe in staying in 5 days after you think you are well and have sunshine and air in your room. MKB, the Red Cross nurse in Morehead City, also described the need for fresh air in her account. Great emphasis was placed on the need of fresh air, cleanliness, and nursing care in every home that I entered. Local health departments also recommended the use of masks. The Wilson Daily Times newspaper frequently published articles about wearing masks. The articles explained that experiments showed that while speaking, people can spray material from the mouth up to 4 feet, and while coughing up to 10 feet. Wearing masks would prevent those who are infected from spreading the flu and those without it from contracting it. Anyone who nursed the sick residents of Wilson County were encouraged to wear masks. The Daily Times frequently encouraged mask wearing and provided instructions for making them. Masks at the time needed 4 layers of butter cloth or gauze, had to be 5 to 8 inches in size, and needed to cover the nose and mouth. Health officials insisted that the masks be sterilized by boiling and to mark the side of the mask worn closest to the face to ensure one always wore the mask the same way. Physicians tried to ease the suffering of influenza patients as best they could. Some prescribed aspirin and morphine to ease the pain, codeine and heroin to control the coughing, atropine as a stimulant. Some doctors even injected patients with the typhoid vaccine, while others tried quinine, hoping they might boost the immune system. Homeopaths treated patients with gelsemium, an herbal drug. Healthy people prescribed themselves aspirin and quinine, among other homemade remedies they hoped would protect them from the virus. A woman in Wilson suggested boiling water and turpentine on the stove in the sick room, then sprinkling it all over the sick room and home. She said this would make the disease less harmful. Letters also show documentation of how residents tried to combat the flu. Maria Whitehurst of Newbern wrote, "Now I take every night 5 grams quinine and asafoetida pill. I haven't been out anywhere since flu started. I thought best to stay at home." Mrs. Raby of Leggett, North Carolina wrote, "I am taking castor oil and spraying our throats. I do hope we'll escape it, for I don't know what on earth we would do if I should have it." Most people were desperate to avoid catching the flu and tried everything they could think of to prevent infection. Some of these remedies might seem strange, but with the overwhelming numbers of flu-stricken patients and the doctor shortage, they tried their best to find effective treatments. Influenza infected every county in North Carolina. Correspondence and newspaper articles from the period provide some interesting insights into life in the eastern part of the state. In this section of the presentation, I will focus on 4 cities, Rocky Mount, Newbern, Kinston, and Wilson, and one event, the Coastal Plain Fair. My primary sources for the Rocky Mount area are the Wilson Daily Times newspaper and Mrs. Raby. She was the wife of a local doctor who was serving in World War I at the time. She wrote to her husband often about the situation in Leggett and nearby Rocky Mount. Some of the information she relayed came directly from local doctors in Edgecombe County. Between 2 of her letters, only 6 days passed, but the number of flu cases in Rocky Mount more than doubled. On October 2nd, she wrote that Rocky Mount had 400 cases of the flu, but by October 8th, there were 900 cases and 15 deaths. Mrs. Raby writes of Rocky Mount churches turning into hospitals, the stores in Leggett closing, and the general fear of Spanish influenza. In her October 8th letter, Mrs. Raby described the situation as such. "The epidemic here is terrible. There are 900 cases in Rocky Mount. Every nurse in the Edgecombe Hospital has it, but 2. They are begging for volunteers to go there to help nurse. In Rocky Mount, the churches are being turned into hospitals. Never before have I known such an awful epidemic in this country. The people who have died that I have heard of only live from 2 to 4 days after being taken." According to the October 10th Wilson Daily Times, the Rocky Mount Board of Health issued a stay-at-home order for the sick on that day. The order prohibited those who currently had influenza or had had it previously from leaving their homes until 6 days after the fever disappeared. The order also prohibited people from visiting the sick. The intention was to prevent further spread of the disease through quarantine, especially because the epidemic was particularly bad in Rocky Mount. Failure to comply with this order resulted in a $50 fine, a large sum at that time. On October 12th, the total deaths in Rocky Mount reached 23, and over 5,000 cases of the flu had been reported to date. An updated version of the October 10th order was issued, stating that visitors providing nursing care to the sick were permitted, but casual visitation was not allowed. In subsequent letters, Mrs. Raby tells her husband about more cases, even mentioning that a local doctor had treated 300 cases of the flu on his own. On October 18th, she noted that the case numbers didn't seem to be decreasing, but by October 26th, it was finally on the decline in the Rocky Mount area. That day, she also wrote, "I hope it will not be long before things get back to normal." A sentiment that rings true today as well. During my research, I found several letters written by Maria Whitehurst during the month of October 1918. Maria wrote the letters to her son, Harold Whitehurst, and provided a fairly detailed picture of the situation in New Bern during the epidemic. Based on her letters and some accounts in newspapers from nearby towns, I've been able to piece together a general timeline of events. Around September 30th, New Bern closed all churches, schools, theaters, and the library to prevent the spread of the flu. On October 9th, less than 100 cases were documented in town, but everything remained closed, and all residents still took precautions to prevent the virus from spreading. By October 14th, the tobacco warehouses and the cotton exchange closed, and the traveling circus was not allowed to perform. The following day, Maria wrote about some of these events and what it was like living in a town affected by the epidemic. She wrote, "You can't hear anything but war and influenza. Every morning when I read the paper, I have the blues for a while. There are always some deaths of someone you know of, if you don't know them. The churches, schools, movies have all been closed for 2 weeks, and tobacco warehouses were ordered closed this week. The circus was not allowed to show here after it came, so they went on to Washington, North Carolina." A few days later, Maria received a letter from her son informing her that he had fallen ill with influenza. She responded on October 21st with several warnings and suggestions for how to take care of himself. She wrote, "My boy, you don't seem to know the danger of this influenza. Please stay in bed. You will have pneumonia. I am worried to death about you. People are dying in every direction of town. If I had known you were going on the trip you did, I should have advised you not to go, especially at such a time as this. I should have thought you would have known better. Stay in, don't go among people." Maria wrote several more letters to her son to check in on him. He did ultimately get better, much to her relief. By the end of October, all public functions in New Bern were still shut down. There was a midterm election that year, and the timing of the epidemic made campaigning difficult. Maria writes about this briefly in a letter from October 28th. "We are not allowed to have any public speaking, even in open air. This flu is interfering with politics. All funerals are held at the cemetery. Not a single one has been held in church." As I mentioned earlier, funerals at the cemetery was a common occurrence during the epidemic. Staying outside in the open air rather than in an enclosed space was believed to be the best way to prevent further spread of the disease. Sometime in November, the epidemic subsided in New Bern and town functions returned to normal. Documentation of Kinston's experience with the flu is found in their daily newspaper, the Kinston Daily Free Press. The newspaper frequently published about the epidemic, but was initially hesitant about the local Board of Health utilizing quarantines to stop the spread of the flu. On October 1st, the paper reported that the flu made its first appearance in Kinston. However, the editors note it is very similar to grippe, a common malady seen during the period. Nevertheless, the paper published a statement made by Dr. J.S. Michener, head of the health department in Kinston. He wrote, "Flu has struck our town. Several cases have been reported. I advise people to let the other fellow go to the circus for them, in the picture shows and public meetings in general as well. Help the other fellow by covering your cough and sneeze. You may be a carrier or have it in the early stages." The following day, on October 2nd, the paper published an update. While the flu was raging in other parts of eastern North Carolina, there were still only a few cases in Kinston. Dr. Michener and the paper said there was currently no need to keep kids home from school, but their parents were encouraged to send their children to school with clean handkerchiefs every day. On October 5th, the paper reported that the Lenoir County Health Board met and decided the situation was not serious enough to warrant closing public institutions, despite other local towns and counties taking this precaution. 2 days later, on October 7th, an estimated 300 cases of the flu had surfaced in Kinston, and the virus was spreading quickly in Lenoir County. By October 10th, the county was under an enforced holiday. All public places closed, and Dr. Michener tried to close the soda fountains as well. The quarantine was planned to continue for at least 10 days. During the height of the flu epidemic in Kinston, the Red Cross Committee and local community established a free emergency hospital to help in providing relief to influenza patients. The Red Cross treated several hundred people in the city and county, in addition to those in the emergency hospital. On October 18th, Dr. Michener asked to extend the quarantine at least another week to ensure the epidemic had passed. The situation was improving with fewer new cases reported, but Michener didn't want to take any chances that it might pick up again if everything went back to full operation. Like in Kinston, the documentation of Wilson's experience with the flu is found in their daily newspaper, the Wilson Daily Times. The newspaper published about the epidemic more than any other paper I've reviewed and provided more information about what it was like day to day. On October 4th, the Wilson County Health Board met to discuss what to do. Influenza had already arrived in town, and they needed to make a decision about public spaces. The board ultimately decided to close the schools, churches, and moving picture shows, and to prevent circuses from coming to Wilson. That day, 125 cases were reported. On October 10th, the Board of Health closed all institutions that sold drinks. These included drink stands, ice cream parlors, cider stands, and drugstore fountains. The closure was indefinite at the time and ended up lasting for nearly a month. On this day, the Board of Health continued to advise people to refrain from congregating on the streets and in stores. The following day, the tobacco markets and warehouses decided to close indefinitely. The Board of Health also ordered all stores to close at noon each day, encouraging phone orders at grocery stores. With the situation still tenuous and cases on the rise, the health official, Dr. Smith, submitted an article on October 21st, advising people to stay home. He wrote, "I want to urge the people who are recovering from influenza to stay at home until you are entirely well of the disease. This is for your own protection as well as your neighbor. A relapse is worse than the first attack. If you do not obey this request, it will be necessary to issue an order which will compel you to remain indoors. This cold, rainy weather is conducive to pneumonia." Unlike Rocky Mount, Wilson did not issue an order to remain home. The Wilson Board of Health relied on the goodwill of people to remain home when ill. Finally, on November 4th, the schools, churches, and stores reopened. Soon after, the tobacco warehouses and markets also reopened. Wilson quickly took control of the situation, and as a result, saw a lower number of cases and deaths than other towns in eastern North Carolina. What is interesting about the Wilson Daily Times is the record of how day-to-day life changed during the epidemic. Earlier, I mentioned the community organization to help feed and nurse the sick, but the paper also included details about how grocery stores and churches worked with the townspeople to continue living their lives as best as possible. The grocery store hours were reduced to mornings on October 11th, but the Board of Health encouraged grocery store deliveries. One local grocer, Carroll Grocery Company, frequently reminded Wilson residents of this in daily ads. Carroll Grocery took orders by phone up to noon and delivered in the afternoon. They wrote, "We urge the people to telephone their orders to the stores when it is possible to do so." Once the stores returned to normal hours, grocers still offered delivery service, even taking orders from 7:30 to 9 p.m. to ensure morning delivery to their customers. Grocers found a way to provide for their customers during an uncertain time, and people were still able to purchase the food they needed. Another fascinating find in the Wilson paper was the initiatives of the local churches. Although the churches closed on October 4th, the ministers still found ways to reach their congregations. Several times, the local churches arranged a joint bell ringing at 11 a.m. on Sunday. The ministers also wrote articles encouraging a prayer hour in place of the normal Sunday service. In these articles, they suggested potential prayer topics, including praying for the sick, for the soldiers at war in Europe, and for those who had died. Additionally, some ministers published suggested readings for each Sunday worship at home. The efforts of these ministers helped provide a sense of community and worship for their congregation during a time when they could not physically be together. The final case study today looks at the regional fair that was planned for the fall of 1918. Through my research, there were several letters and newspaper articles that mentioned this fair. The Coastal Plain Fair was supposed to be held in Tarboro, October 29th through November 1st. Throughout the month of October, there was much speculation about whether it would occur or not. A Tarboro resident and friend of Dr. Raby wrote the fair on October 15th, saying, "We are getting ready now for the big fair in Tarboro, but are not sure yet if they will have it on account of this epidemic all over the state. They have cut out most all of them in the state." Newspapers published similar speculations. Finally, on October 25th, Williamston's newspaper, The Enterprise, announced that the fair was canceled to prevent further spread of the flu in eastern North Carolina. As mentioned before, the death toll was staggeringly high during the influenza epidemic. At least 50 million people died worldwide, and over 13,000 North Carolinians died from the flu. After seeing the death and infection rate in North Carolina, the North Carolina State Board of Health sprang into action. The board members recognized that the lack of healthcare professionals in rural areas contributed to the high death toll in those places. In a document about rural health from the 1919 Public Documents of North Carolina, the North Carolina State Board of Health recommended, quote, "that rural health be provided for by an appropriation from the state and federal government." Dr. Watson S. Rankin, chief public health official for North Carolina at the time, spoke about before the United States House of Representatives Committee on Agriculture in support of the Rural Health Act on February 17th, 1919. The bill later passed and provided money for a rural hygiene program in North Carolina and other states. North Carolina received $50,000 for rural sanitation improvements. Each year, the Medical Society of North Carolina printed their meeting minutes in a publication entitled Transactions of the Medical Society of North Carolina. The meeting included presentations by members and annual reports for the county health departments. During the 1919 session, some counties reported how the influenza epidemic affected their populations. Some departments were unable to report about the flu because they were so overwhelmed by the epidemic. However, the Wilson County Health Department stated that the epidemic of influenza has been the most potent factor in popularizing the work of our department, demonstrating that following the epidemic, people were much more interested in public health. This sentiment is seen in the daily papers from Wilson because the local Board of Health mobilized care for people and organized community members to feed and nurse the sick. There was a positive feedback for these efforts, and the Board of Health believed their numbers were lower in Wilson because of their work. The influenza epidemic revealed the inadequacy of the existing public health system. The lack of hospital bed space and the need for hospital upgrades became apparent during the fall of 1918 in particular. Not every county had public health departments at the time, and the rural areas did not have enough doctors. Members of the state's medical and public health communities began to request more funding to promote public health and to expand public health agencies. The 1920 biennial report of the State Board of Health presented the budget for the previous 5 years. The graph on the screen shows the state appropriations data from 1917 through 1921. There is a steady increase in funding each year, but huge increases in 1920 and 1921. These increases show the investment the state began making in public health, as well as the success of local leaders and public health workers in their effort to acquire these appropriations. In the decade after the pandemic, new hospitals were built across the state, and existing hospitals were improved to meet new treatment codes. More county health departments were also established. The increase in public interest in state funding for public health cemented its role and function in North Carolina society. Influenza is still one of the most contagious diseases in the world. Flyers like the one on the screen are still distributed and posted in public spaces across the United States. The methods for reducing the spread of disease are typically the same as the suggestions made by the North Carolina Board of Health during the 1918 epidemic, including covering your cough and sneeze and wearing a face mask to protect yourself and others. These methods, as we are aware, are also our best defenses against COVID-19. One key difference is while we are in the midst of vaccinations for COVID-19, in 1918, they did not have enough understanding about the source of the disease to develop a vaccine. Vaccines like the typhoid vaccine were administered, but did little to prevent contracting the disease. Many of the events I have described today are extremely similar to what we are experiencing right now. Prevention discussions were similar, day-to-day life became similar, and the importance of public health became quite apparent. In 1918, the epidemic helped spring the public health movement into action. During this crisis, we are also learning so much more about public health and gaining a new appreciation for it. Thank you for the opportunity to present today. I hope you enjoyed this presentation.